We have a question from UP Visayas, Iloilo. The moderator of the UP Visayas, Iloilo this afternoon is Dr. Mark Dondi Arboleda. Please come in, UP Iloilo.
Okay, hi, good afternoon, everyone. My name is Inri, BS Public Health student of UP Visayas. My question is, how can you promote the use of generic medicines to the public, knowing that there are still people who doubt the effectiveness of generic drugs? Thank you.
Thank you. Dr. Go will answer the question.
Thank you for your question. It's a very relevant topic, as well as a question that commonly being asked by medical practitioner. Well, we have to strengthen our Bureau of Food and Drug in terms of improving its capability, but they have to be transparent. They have to tell us whether what they tested are okay or not okay. Currently, that information is missing, and therefore the information out there is distorted and skewed, and nobody knows whether these products can be trusted or not trusted. Thank you.
Thank you. Do we have any question from the audience? You can come in at any time. Please go ahead and identify yourself.
Good afternoon. I'm a student of Health Policy in UP Manila. I'd like to direct my question to Secretary Romualdez. Secretary, I fully agree with the 6 building blocks that you mentioned, but if we were to prioritize the top 2, what would these be?
I think the 2 that actually will influence the rest the most, we need to take a very hard look at the way we recruit, train, and deploy our health professionals. So human resources for health is number 1. Number 2 is healthcare financing, because everything else will move in accordance to how we finance and how much we spend for healthcare. Thank you.
Yes, go ahead, please, and then.
I fully agree with the number 2 concern, which is that the public is not protected, especially from business interests. So my question now is, what will be your recommendations on how we can protect the public from business interest, and trying to make sure that the health concerns will be given of premium importance?
Well, I think, thank you for the question, Dr. Limpin. We're together in the Philippine College of Physicians. I think first and foremost, public health should be the paradigm among the regulators that we have in our Department of Health. Unfortunately, in the practice of technical knowledge, the public health context is missing. Maybe they should enroll in public health courses in UP Manila. The second one is to protect them from regulatory capture by industry and politicians. Unfortunately, as I said earlier, you can get sued for flimsy excuse. And the RA 9711, the recent law passed, which is the FDA strengthening law, does not protect them. It only gives a condition, a provision there that they could save their income so that they can use it as a legal fund. But beyond that, I think that has to be strengthened further, maybe to the implementing rules and regulation of that law, how we interpret it.
Okay, I'll take one question from the audience, and then we'll turn to UP Manila. UP Manila, stand by, please.
Thanks, sir, Professor. Congratulations to our panelists. I'm Dr. Tony Liachan from the Philippine College of Physicians. I'd like, sir, madam, to synthesize, I think, the discussion, and then ask the third question. I think the first one would be enhancing human capital is basically increasing the health and, of course, the education. Hindi sa Pilipinas, so kasi kung hindi ka nakapag-aral at hindi ka malusog, wala kang kinabukasan. So that's basically the understanding na may fighting chance ka kung healthy ka at educated. So that can actually equalize everything kung mahirap ka o mayaman ka. The second, I think, na nakuha ko is about the education per se, the information. Battling disease is a problem, but the bigger problem in the country is basically ignorance. And I think education in the mainstream of the Department of Education can empower every Filipino to take care of themselves without being dependent on the doctor. So my last question will boil down to healthcare infrastructure. 50% of the doctors are actually in Manila. You have the brain drain and a ballooning population. But one aspirin daw can cost about 100 pesos in Biliran. And one particular consultation will cost 5,000 bucks. You know why? Kasi mag-aeroplan from Biliran to Manila. And aspirate, magbabangka pa siya at magta-tricycle to get a 1 peso aspirin. Now, take a look at Camsur, may namatay na executive. Take a Boracay, si Dennis Trillo's friend, namatay doon. That's a post-resort hotel. And then, of course, the boyfriend of Claudine Barreto died, of course, at Dos Palmas. These are post-resort. Even Henry C. cannot survive in that kind of hotel. So, meaning to say, at the end of the day, it's about healthcare infrastructure. So, if there are hospitals in the countryside, like the daughter of Secretary Cabral right now in Palawan, because there is healthcare infrastructure, then perhaps we can push away the doctors and prevent the brain drain, and there will be available doctors. So I was just wondering, if there's one hospital for every barangay, that's 36,000 hospitals, that's 1,500 municipalities and 70 provincial hospitals, then perhaps the doctors in Manila or Secretary Cabral will not go to the far-flung areas to provide medication and support during calamities. Thank you.
Would you like to respond to that? Ernie?
Let me respond to my good friend, Dr. Leachon. While hospital is an important component of a health system, and in fact, without giving details, it can be used as a center point in our recommendation for reform. Not all places will require a hospital. In the same way that not all places has to be manned by a doctor. That's the point we are making. And therefore, in any reform system, the peculiarity of a given place, the infrastructure available, the manpower available must come into the equation of formulating what is best for the place.
First point regarding hospitals. It would be ideal, but the cost will be way, way higher than what we're asking for if you want a hospital in every area. And the second point is the need for information. The simple example of aspirin being required for every fever is an effect of advertising rather than information and education. When people are taught to use aspirin first before the punas or bimpo of a mother, that shifts the trend to medicines and hospital to information which can really correct the needs of our people. The reason I try to advocate for information is it's always good to have equity in income, equity in development, but those two require revolutions which I'm too old to enter. But I have found that educating women, especially the mothers of children, can do a lot more than having to build hospitals or buy too many expensive medicines.
But isn't this not part of the health curriculum in the school system, the grade school and high school?
Yes, there is some, but it's not. It does not become a part of the way of life because of advertising and because of the way the health infrastructure has become medicalized, completely technology dependent. Yes.
Ernie?
No, I was just going to give the example of this nice disease called H1N1. And for everyone, this is an example of something where a lot of noise was made, not really because people were suffering or people were dying and so forth, but mainly because people saw that it was something that the new technology can answer. There is now a big debate about whether or not a vaccine needs to be used. The fact is, diseases like this can best be preventable or alleviated by simple measures of segregating people, changing the way we live, changing the way we look at things. Not really having a readily available bullet for every problem that we get. Yes, Ernie.
Yeah.